Hello. So today I want to talk to you about a subject that's really not very glamorous, but really is important, and that's really kind of related to constipation, or is your constipation telling you something about your overall health? So first of all, constipation is really defined as difficulty passing stools. Often you have infrequent bowel movements. Usually you have to have excessive straining to really have a bowel movement. It really can affect your daily activities. Now, chronic constipation is constipation that persists for weeks. So we'll talk more and more about the constipation, but really chronic constipation is really something that indicates that there's a problem, and that you really should be seeking kind of an answer to this. So what are the symptoms of constipation? Well, you may have hard, lumpy stools. You may have fewer than 3 stools a week. You may feel like you're not totally emptying your rectum when you have a bowel movement. You may feel like there's something blocking your rectum in having a bowel movement. You have to have excessive straining to have your bowel movements. And then you may have to kind of help empty your bowels, such as pressing on your abdomen during having a bowel movement. So really, if you're experiencing 2 or more of these type of symptoms for at least 3 months, that really means you have chronic constipation, and that you really need to do something about it. So what are the health implications of constipation? Well, constipation is actually a very common condition. It can affect over 80 million people. But really, despite this common occurrence, it's important to understand that chronic constipation is not normal, and can really have an impact on your health. So when you think about health, healthy digestive and daily waste, basically there's excretion of these byproducts by your liver, and then these toxins are deposited within the intestine. So if you're having digestive system problems that are making it difficult to excrete these toxins in a timely manner, then your body actually can reabsorb these toxins. So, and these toxins can make you feel miserable, and they actually can have a harmful effect on your health. So it's really important that we understand constipation and really do take action to make sure that we're addressing it appropriately. Well, what is it your gut's maybe trying to tell you? Now, it's not uncommon to have periods of constipation, but chronic constipation is what we're really talking about here. But really, if you have irregular bowel movements, that can be an indicator of maybe a potentially underlying health issue. So some things to consider. So constipation, it may be an indication that you're maintaining an unhealthy lifestyle, such as poor diet, poor physical activity. These are really the most common causes of constipation. So therefore, it's really best to rule these out before you start looking for other possibilities. So some lifestyle factors that can affect your bowel movements include heavy consumption of meat and dairy products, diets rich in processed foods that are high in fat and sugar, insufficient fiber in your meals, inadequate water intake, excessive alcohol or caffeine, lack of exercise or low physical activity, and really putting off using the bathroom when you get the urge, so kind of retainment. So the following kind of things are some lifestyle changes that can help relieve this constipation. Obviously, the first is increase your fiber intake. That includes more whole grains, fruit, vegetables. You may want to take a fiber supplement with lots of water. Increase your physical activity. And this can really be as simple as a 30-minute walk every day. Use the bathroom as soon as you have the urge, and then obviously reducing your alcohol and caffeine intake. What are some of the medical illnesses that might be related to constipation? Well, first I want to talk about hypothyroidism. So the thyroid is the gland that sits in the front part of your neck, and it produces your thyroid hormone. And then really this hormone plays a very vital role in your metabolism. So if your thyroid gland does not produce enough hormones, such as hypothyroidism, your metabolism is going to significantly slow down. The slowing in your metabolism really consequently will slow down your digestive system, which will result in constipation. So hypothyroid symptoms typically develop slow and over time. And besides constipation, an underactive thyroid or hypothyroidism someone suffering from this may also experience, increased cold sensitivity, fatigue, dry skin, brittle nails, thinning hair, For women, irregular menstrual cycle, and then weight gain and kind of a puffy face and memory impairment. So you really should talk to your healthcare provider if you're experiencing constipation plus any of these above symptoms, because the reality is they probably need to run some thyroid function tests and make sure you don't have an underactive thyroid. And the good news is if you do, there's some medicine they can prescribe for you that really can help improve these symptoms and help address hypothyroidism. Another illness is diabetes. This also is another hormonal issue where your body, doesn't produce enough insulin. Insulin really is the hormone responsible for breaking down the sugar in your bloodstream, and insufficient insulin means that your body can no longer break down these sugars in your blood, which really causes your blood sugar levels to rise. And this continuous kind of elevation of the blood sugars really can damage the nerves. And also these nerves that you damage are the ones that control your digestive tract. In fact, some studies have shown that the damage to your digestive tract can result in constipation, really meaning that diabetes or the prolonged elevation of blood sugar is really a problem. So it's important that we address this. So if you're diabetic or not a diabetic, but you're suffering from the constipation, it's important to kind of consider these things. What are some other symptoms associated with diabetes? Usually frequent urination, especially at night, excessive thirst, fatigue and weight loss, and blurred vision. So if you're experiencing these symptoms, then you really should also kind of seek the guidance of your doctor so they can run some diagnostic tests to make the appropriate diagnosis. And then if that's the case, then they can prescribe some medicine that can also help in this case. So another thing that's real important. Another illness that affects your digestive system is irritable bowel syndrome. So it's really unclear what really causes IBS, but it really results in a problem how your brain and digestive system communicate. It can be difficult to diagnose this because the symptoms can be vague, but one of the symptoms obviously is constipation, but you can also have bloating, abdominal pain and cramping, occasional urgent diarrhea, and then passing mucus along with the feces. But again, this is something you'd want to talk to your doctor about based on your symptoms to get the diagnosis. Another thing that can really affect your digestive system is anxiety. So stress or anxiety really causes your body to go into this fight or flight mode. And in this mode, your sympathetic nervous system really becomes more active and your digestive system really slows down significantly. So generalized anxiety disorder, this really is an anxiety that doesn't go away. And this can really impair your digestive system and really result in constipation. Some other symptoms of generalized anxiety disorder include restlessness, excessive worrying, difficulty concentrating, irritability, insomnia. And again, if you're suffering from any of these, it might be wise to talk to your healthcare provider about ways to manage your anxiety, whether it's therapy, counseling, medication. Again, but the common denominator here is anxiety or prolonged generalized anxiety can really lead to constipation. Along these lines is depression. The reason depression can cause constipation is kind of a multitude of factors, but really when you're depressed, you're more likely to stay in bed all day, which really reduces your physical activity level. In addition to that, often when you're depressed, you're consuming a lot of sugar-rich foods and really just not eating well. And so these changes in the diet and lifestyle can really result in constipation. Other symptoms of depression include loss of interest in enjoyable activities, a feeling of despair, hopelessness, worthlessness, fatigue and trouble concentrating, suicidal thoughts, angry outbursts, and loss of appetites. Again, this is something you really should speak to your healthcare provider if you're experiencing these symptoms. The good news is that there's ways to address your depression, whether it's through, like I said, counseling, medication, but it's important to understand that these things can be addressed. And with that, your constipation should really improve. So some other health issues, sometimes constipation may be due to really more severe health issues. For instance, brain or nervous system issues that can affect your nerves that stimulate the contraction of your intestinal muscles. So This is going to result in a slow stool movement and therefore constipation. Bowel obstructions with something like a cancer or a tumor can also result in constipation. However, constipation is usually not the only symptom in these types of cases. So other serious health issues that can cause constipation include multiple sclerosis, hypercalcemia, Parkinson's disease. These are just some other things. So again, chronic constipation shouldn't be ignored. Another health state that often results in constipation is pregnancy. Constipation is a common occurrence during pregnancy, really with at least 40% of pregnant women experiencing it. This really happens because your body produces more progesterone, which has kind of this, shows this reduction in intestinal muscle contraction, and therefore kind of delayed or prolonged elimination of waste, which can lead to constipation. Now, another thing to note here is you really should talk to your doctor about ways to treat the constipation that are safe in pregnancy, because some things you shouldn't be doing or using when you're pregnant. In addition to this, there's certain medications that can really cause constipation, and so it's important to understand what those medications are. So your opiate analgesics like morphine, nicotine, calcium channel blockers, some diuretics, certain antidepressants and epileptic medicines can all cause constipation. So if your bowel movements change after starting really any of these medicines, you really should speak to your doctor about, is there other alternatives, or can we adjust the medicine so that I'm not suffering from this constipation. So really the key theme today is, chronic constipation really may indicate that you need to change your lifestyle and really concern your diet and physical activity. That would be the first thing to do. But also important to note that you really should seek your doctor's opinion and help if you don't see improvement in your constipation after making the appropriate lifestyle changes. It's because constipation can be due to underlying health issues, especially if it's accompanied with these other symptoms like hair loss, fatigue, weight change, vision issues, and abdominal cramping. So it's important to understand that chronic constipation is not normal, and that it's something that needs to be addressed. Typically, you start with the lifestyle changes, but there can be more serious causes of this. So, having chronic constipation doesn't automatically mean that you have an underlying health condition. However, it's really a good idea to talk to your physician about that to ensure that there's no underlying health issues. So remember, not a glamorous subject to talk about, but really your bowels are telling you a lot of stuff, and paying attention to what your gut's saying to you really can help you on your health and wellness journey, specifically when things are not working well, such as constipation. So remember, constipation is not normal, and there are things you can do about it. Specifically, your lifestyle changes and physical activity are really the things that you can do to address this. And if these things don't seem to improve the situation, then really you should reach out and talk to your doctor. So I hope this is helpful as you continue your health and wellness journey. And remember, if there's anything we can do for you, just don't be afraid to reach out and ask. Thank you.